My vision was and remains to deliver the best care possible and to deliver world-class care in facial rejuvenation. So to that end, I spent time traveling and dedicating time with the best experts in their fields to further develop techniques in facial rejuvenation and rejuvenation of the neck and in rhinoplasty. I chose to establish my practice here in Beverly Hills because this is really the hub. This is really where the most advanced care is delivered to patients from all around the world. And I designed my practice to have the opportunity to offer the best care possible in the best and safest environment and to give world-class care. One of the patients that really affected me during my surgical training was a patient who was suffering from an 80% total body surface area burn injury. So we were trying to reconstruct this patient while the patient was in a coma and trying to really bring this patient back to their initial state and trying to reconstruct their face. And after multiple surgeries and eventually the patient waking up from medication-induced sedation and the patient woke up to a condition that was really worse than what they had started with due to the injury and the multiple surgeries that were required. And this really affected me, and I realized how some of our techniques were limited, and there was really so much that we could offer this patient from an aesthetic and from a functional perspective. And that was really what pushed me to go and spend the time studying and developing facial transplantation and spend the years doing that, and then spending years really training in plastic reconstructive surgery. I never forgot that. And plastic surgery is a beautiful field where every patient we interact with has a different story, has a different problem we're trying to solve, and what we do matters so much to the patient, but how we do it matters a lot too. Because that feeling never left me, I always tried to develop and learn techniques that create the least injury to normal anatomy, that reconstitute normal aesthetics, natural aesthetics, that place scars in hidden areas, that in natural folds, that give the patient their full functional capacity, but at the same time give them an aesthetic, not only the aesthetic that they envision, but an aesthetic that will give them a seamless natural result. And that's always been kind of my guiding compass.